common retinal problems today which are occurring in the eye. They are not so common like cataract and glaucoma, so many patients are not aware of it. The idea of this presentation is to get you to some basic knowledge about these problems and how they are treated, so you are well aware of it, so that you can pick it up early in case if you are one of them who suffer it, or you can help your relatives to guide the treatment. Now the problem what I am going to discuss now is central retinal vein occlusion. Now in this there is a clot in the retinal vein, as the name suggests, into the central retinal vein, as a result of which you have blood coming on the retina. As you see that there is blood all around the retina, and there is dilatation of the swelling of the veins also, and there is swelling of the retina, the important part called macula. Now we assess the amount of this swelling and type of this swelling by a test called OCT, or optical coherence tomography, which shows that there is swelling in the retina with a cyst and spongy like appearance here. Now this patients would manifest in the form of diminished vision or defective vision, and which would occur over a period of 2 to 3 days. Now unlike branch retinal vein occlusion, which the name suggests is branch, this is central retinal vein or the main retinal vein. So the impact of this on the vision is much more than branch retinal vein occlusion, and the disease is more severe. What are the common causes leading to central retinal vein occlusion? The commonest causes being old age, diabetes, blood pressure, high blood pressure, glaucoma. So it is important to control your diabetes, blood pressure very properly. If you have glaucoma, it is important to control intraocular pressure with treatment to avoid these diseases. And if you have this with central retinal vein occlusion, the treatment of all these conditions is very important. As far as treatment of eye is concerned, it is in the form of giving injections in the eye of Avastin, Lucentis or Eylea or VEGF trap, or steroid or Ozurdex injections, as we tell. The results of this treatment is reasonably good. In more than 50% of cases, there is reduction in the swelling in retina and improvement in vision. However, unlike branch retinal vein occlusion, this is more severe disease and may take about a year or two for the treatment to be effective, because by that time the clot in the retina dissolves and the collateral circulation starts acting and the swelling may reduce. However, some patients may remain to have chronic or persistent swelling in the center of the retina called macular edema and may need treatment. Laser is also an adjunct in the treatment in this type of diseases. Sometimes when there are new vessels on the retina or on the optic disc with vitreous hemorrhage, lasers may help to get them solved. Or there is a commoner condition called neovascular glaucoma, in which there are new vessels on the iris, and because of which there is high intraocular pressure. In this patients, giving this Avastin or Lucentis injections help, and then we do laser treatment, and if necessary we do glaucoma surgery also. As I told you, this condition is reasonably common and one needs to be aware of it. If you are having blurring of vision and you are more than 40, it is important that you see an eye doctor and insist on getting your retina checked, insist on getting intraocular pressure checked to rule out glaucoma. The treatment would be in the form of Avastin Lucentis injection or Ozurdex injection. One has to be patient and perseverant for the treatment of this type of diseases, because it may take a year or two, and probably still 20% of patients may not recover good visual acuity and may be unhappy. To prevent this, again, monitoring intraocular pressure is important. The recent treatment, basically in the form of injection, has made a lot of difference in the management of this type of diseases. So it is important to diagnose them in time, do all blood investigations, treat any abnormality with the health of the patient, treat the eye is the motto of the treatment. Thank you.